Imagine me and you, I do. I think about you day and night. It's only right.
The diagnosis of cancer, there is always that scare, anxiety, and of course the stigma that comes with it. When we say cancer, what implies to us is that, what it would imply to us is that it is a very deadly disease, it is life-threatening, but then nowadays, this disease has become very common, I would say, not because it is an epidemic or what, but because probably people have become very worried about it, and they have become knowledgeable about its signs and symptoms, and so much has developed in terms of science, in terms of technological improvements, and there is already a sense of aggressiveness in the treatment of cancer. And proper documentation with tumor registries and with information dissemination going on around us, we now have come to know the disease called cancer. And people have now become more cautious and become more aware that they have to go and see their family, or they have to ask their doctor as to what has to be done in whatever they feel in their bodies. Now, in the last topic that we had, we talked about a patient's coping mechanisms upon diagnosis of cancer. Now, we will be talking of the patient's coping mechanisms while undergoing treatment for cancer. It is no easy task for a doctor to appraise the patient that is treatment for cancer. For the very early cancer, it's already the gold standard, or it already has the curative objective to aim for cancer, and no other intervention needs to be done. That is why we need to tell the community that early detection and early intervention is really the most ideal action that we should take into our hands. Early detection and early intervention comes cure. Avoid that we still see patients who have advanced, very aggressive disease, that even surgery is not the first recourse. Rather, we tell the patient that we need to go systemic, or we need to go and give treatment that would enter the human body, enter all the vital organs of the body that may be involved with the diagnosis of cancer, of what she has to really go undergoing treatment, and what she has to avoid, so that she would feel less, down and less miserable when she is undergoing treatment. A lot of things are still to be discussed when patient has to undergo chemotherapy, the things such as to cope with, the coping mechanisms such as to adapt in order to help herself. And a lot of this will depend upon the doctor and the patient's interaction. It will depend also upon the full cooperation of the patient, and how honest and sincere and competent the doctor would be in trying to impart to the patient what the patient will be undergoing, but that the patient could be helped while undergoing them, to inquire on anything regarding cancer, or anything regarding quality of life that we have to adapt well while undergoing treatment for cancer. Please do not hesitate to email us at goodday, which is gooddaywd@yahoo.com. So friends, you are welcome. Inquire so that you will be informed. Thank you.
Imagine me and you, I do. I think about you day and night. It's only right to think about the girl you love and hold her tight. So happy together.